Good morning to all of you who make this broadcast possible, to Raul supporting us from the studios, to our sign language interpreter, to our radio stations also broadcasting this briefing, and to all of those following us from different parts. Excuse me while I remove my face mask. Today, the behavior of the pandemic in Cuba is as follows. 507 people are hospitalized in Cuba, 17 are under observation, there are 302 suspected cases, and 188 confirmed active cases. Quite a high number. In our primary healthcare system, 4,850 people continue to be monitored. These are people that have been discharged from hospital and are now completing the 14-day mandatory post-COVID-19 monitoring period. This group also includes people living in areas where an outbreak has occurred and who are being monitored by their local doctor until the outbreak is resolved, in case they develop symptoms, in which case they then become a suspected case. Yesterday, over 3,000 samples were processed. 3,340 to be exact, were processed in our various molecular biology laboratories. 1,510 were processed at the Pedro Curie Tropical Medicine Institute, 471 in Havana's Hygiene, Epidemiology and Microbiology Center, 441 in Villa Claras, 190 in Santiago de Cubas, 358 in the Genetic Engineering and Biotechnology Center Lab, 316 in the Hermano Almahedes Hospital Laboratory, and 54 in the Civil Defense Laboratories. Of the 3,340 samples processed, 13 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country to 270,989, of which 2,646 have tested positive for the virus. Like always, samples were taken from all of the country's provinces. 211 from Artemisa, which has reported various cases recently, 2,403 from Havana, the most of any province, 109 from Matanzas, 99 from Villa Clara, 96 from Santiago de Cuba, 71 from Ciego de Ávila, and so on and so forth. Samples were studied from all of the country's provinces yesterday. The 13 positive cases diagnosed yesterday are all Cubans. 6 are confirmed case contacts, representing 87% of all positive cases in Cuba. This is why some people wonder, or let's say ask, this is why some people ask why they have to be isolated and tested if they were only in contact with an infected person for a brief period of time. And I think the fact that 87% of all confirmed cases had prior contact with someone who tested positive for the virus shows us just how important it is to isolate and test everyone that has come into contact with someone infected with the virus over the last 14 days. Of the 13 cases diagnosed yesterday, the source of infection linked to one case is yet to be determined, bringing the total number of cases where it has not been possible to determine the source of infection to 125, or 4.8% of all confirmed cases. Meanwhile, 6 people contracted the virus abroad, which means that these cases do not count toward Cuba's overall local transmission rate, as they did not contract the virus in the country. These 6 cases take the total number of imported cases in Cuba to 212, or 8.1% of all confirmed cases. 8 people diagnosed yesterday are female, for 49.8% of all cases. while 5 are male, representing 50.2% of all diagnosed cases. 10 of the 13 was asymptomatic at the time of testing, a dangerous feature of the virus. These cases account for 54.4% of all confirmed cases on the island. When we look at this figure over the last 15 days, it rises to 58%. By age group, one patient is between 1 and 19 years of age, a 2-year-old girl that tested positive for the virus yesterday. This case brings the number of children, or those under the age of 20, who have been diagnosed with the virus in Cuba to 306, all of whom are clinically stable and responding well to treatment. That is to say, 279, or 91.2%, have been discharged from hospital. 4 cases are between 20 and 39 years of age, 7 are between 40 and 59, and 1 is over 60 years of age. Of the 13 confirmed cases yesterday, 6 are from Havana and 6 are from Pinar del Rio, and 1 case is from Artemisa. The 6 cases from Pinar del Rio are all imported. These cases are from the municipalities of Pinar del Rio, Guanes, Minas de Matahambre, and San Luis. The 6 cases from Havana are from the municipalities of Marianao, Playa, La Lisa, and Habana del Este. And the 1 case from Artemisa diagnosed yesterday belongs to the municipality of San Antonio de los Baños and is a confirmed case contact. Yesterday's result means that Cuba's confirmed case per 100,000 inhabitants rate over the last 15 days rises from 1.35 to 1.38. Artemisa's rate also rises to 14.76, as does Havana's to 3.65. Villa Clara's rate remains the same, standing at 0.39 per 100,000 inhabitants. As such, 2,646 people have been diagnosed with the virus thus far in Cuba. 188, or 7.1%, are active hospitalized cases, 187 of which are clinically stable. The patient being treated at the Dr. Luis Diaz Soto Hospital continues to be in a critical state. Critical, but stable. No deaths have been reported in Cuba for the last 21 days. Since the pandemic began in Cuba, the island has registered 87 deaths, for a mortality rate of 3.29%, which, compared with the regional rate of 3.79%, places Cuba in 21st position in the Americas, and the global rate of 3.87% places the island in 113th position after Eswatini took 112th place yesterday, moving Cuba down to 113th. I know that, just like myself, many of you will be thinking, I have never heard of Eswatini. Well, it's a small country located in southern Africa, and I'm telling you this because in medicine we have a saying that goes, it's not enough for a doctor just to know medicine. A doctor must know everything. So, Eswatini is a sovereign state located in southern Africa, between South Africa and Mozambique, and is ruled by an absolute monarch. You may have heard of Swaziland. Well, Eswatini and Swaziland are the same country, but in July of 2018, King Mswati III decided to change its name to Eswatini, which currently holds 112th position, and Cuba 113th. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 2 people were discharged from hospital, one from Artemisa and the other from Havana, fewer than those who tested positive for the virus yesterday. This means that to date, 2,369 people have recovered from the virus in Cuba, representing 89.6% of the total. And, as I have repeatedly stated, and I say this again now because I've been asked about it, after being discharged, patients are monitored to detect any after effects of the virus and problems linked to breathing, smell, taste, for example, and to monitor and treat these symptoms. The 2 patients discharged yesterday means that 2,369 people have recovered from the virus, while there continues to be 1 patient in a critical but stable state. Now we're going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. The total number of COVID-19 cases worldwide currently stands at 17,579,197, after 282,894 people were diagnosed with the virus yesterday. Yesterday, 6,215 people died of the virus, for a total of 679,505 COVID-19 fatalities and a mortality rate of 3.87. In the region of the Americas, which accounts for 54.05% of all COVID-19 cases worldwide, 173,091 new cases were reported yesterday, for a total of 9,501,405 confirmed cases. Of the over 6,000 COVID-19 related fatalities reported yesterday, 4,156 occurred in the region, bringing the COVID-19 death toll in the Americas to 359,738 and a mortality rate of 3.79%. The list of worst affected countries continues to be topped by the United States, then Brazil, India, Russia, South Africa, Mexico, Peru, Chile. As I was saying, it's important to note that over 1,000 people died in the United States and in Brazil in a single day yesterday. We're talking about 1,244 in the US and 1,212 in Brazil. I mention these figures to make people aware, especially those acting carelessly, that this is an illness with serious symptoms, an illness that kills and is extremely dangerous given its infectiousness. This is the information we have on the behavior of the pandemic in Cuba and across the world.